First, I wanted to say, for those of you who weren't there at the small event we did, how thrilled I am to have Weiping Wu as part of our faculty, having taken the leadership of the urban planning program. As I mentioned, it was an unbelievably extensive search. We interviewed over 20 people, and at least, if not more, and Weiping was just so striking in her thinking as one of 3 scholars specialized in the question of urbanization in China, questions of migration, and someone who has extensive institutional building abilities as demonstrated by her leadership at Tufts University, and someone who's really been kind of bringing together theory and practice through her engagement with institutions such as the World Bank. Weiping really appeared to have all of these incredible qualities we were looking for as a committee, and I was looking for as a dean to lead the planning program. As I've often said, it's clear that architects are not going to save the world, but planners might. And in the last 2 years as dean, it's been really incredible for me personally to learn more about planning. And I'm really excited about the future of the field and the future of the program at the school. And so as part of that search, we also sort of fell in love with, I can say, as a committee, with Malo Hutson, Professor Hutson from Berkeley University, who's also leading the field in terms of asking questions about health, public health, and urbanization, and how they intersect with questions of accessibility, of race and space and urbanization. You know, these, as we have seen in the last 2 years especially, these questions are really incredibly important for us to address head-on. And while Weiping will introduce him formally, I just want to say that I'm also very thrilled to have Professor Hutson with us today. And I can share that we're also hoping that he will join us, so cross fingers, but this is really an introduction, I hope, to all of you. But first, a few words from Director Wu.
Thank you. Thank you, Amal. I know our students can speak to this, that the support from the school and the Dean's Office for the planning program, and we're very happy to see that, and we're also very, very happy to have Malo here today, and to speak on a topic that's really of interest, as you will see this afternoon. If you have talked to the students, of very much interest to a lot of our students. So Malo is currently associate professor and the Chancellor's professor of city and regional planning at Berkeley. As Amal has already mentioned, he's really focusing on a number of areas that relate to the built environment and health, community development, and as well as sort of urban sustainable development, equitable development. And his most recent book is titled The Urban Struggle for Economic, Environmental, and Social Justice, Deepening Their Roots. What we find really attractive also in Malo's work is how he has a public presence in his scholarship. And he has, for the last 15 years, worked with a number of cities, both in the United States, as well as in Europe, as well as in Latin America. And his scholarship also is widely recognized by government agencies, professionals, and nonprofit organizations. For instance, he's been invited to the White House. He's been working also in consultation for the Federal Reserve Bank and other foundations and international governments. Malo earned both his Bachelor of Arts in Sociology and Master of City Planning degrees from Berkeley, and his doctorate in urban and regional planning from MIT. So welcome, Malo.
Wow, what a great introduction, and just being so warm and welcoming here at Columbia. I have to say, today has been a wonderful day. One of the highlights of being professor is getting to know students. And I happened to have a great afternoon conversation with a number of students, and happened to turn around and I saw a student she said, "Are you Professor Hutson?" I said, "Yes." She goes, "I'm Stephanie Chan. I was in your very first class you taught at Berkeley in 2008. So here I am, and we crossed paths again, and she's doing wonderful work here at Columbia. So it's just great to meet the students. And of course, thank you so much for Dean Andros and Weiping Wu, for Professor Wu, for inviting me here to speak to you all. So as the title of my talk says, I really want to discuss my work at the intersection of community development and health equity. Let me see, touched on this. So when we think about places and health, like, I'm really concerned, like, why does where you live matter? What are the pathways that impact your health? And I'm also interested in the role of institutions in the distribution of resources. If you look at large metropolitan areas, you'll see fragmented governments, private school districts and other types of school districts, or private schools and other types of school districts that may not really coordinate with each other. You'll have some cities that are very small with their own police department, their own social service programs, and so forth. And so I'm very much interested in that as well. And then community development, urban sustainability, and the built environment and health, which I'll get into more details later. I was fortunate enough to be a Robert Wood Johnson Health and Society Scholar when I finished my doctorate at MIT, and I was really influenced by the work of George Kaplan, who spent many years at the University of Michigan in the School of Public Health, and really did one of the key longitudinal studies on poverty. And one of the things he always talks about is, when you're looking at health, you have to think of the life course. And how do social and economic policies, institutions, neighborhoods, and communities, all of these things have some impact on people's life. And I have colleagues that I work with that do work around epigenetics and so forth. But today I want to focus my lecture really around some individual risk factors, but certainly social relationships, and how these broader social and economic policies really impact us and our quality of life. Oftentimes when I am giving these lectures, some people would ask me, well, how does planning relate to health? And if you look at the social determinants of health, certainly, really it's just the conditions where we're all born, where we live, where we work, where we go to school, where we play. All those things impact us, right? But if you look at the World Health Organization, they take a very direct approach in how they think about social determinants of health, how they're shaped. And they say it's the distribution of money, power, resources at the global, national, and local levels, which are themselves influenced by policy choices. They're influenced by policy choices. So the idea is, if we look at the health disparities that exist, whether it be infant mortality, life expectancy, all the things that many of you have read about or hear about, the diabetes epidemic around the world, crime and violence, much of this can be addressed if we think about it from a policy perspective, right? Not everything's going to be solved that way, but certainly we can have some impact. And if we're talking about health equity, and there are many definitions of health equity, but really a simple definition that many people use, it's the attainment of the highest level of health for all people. Health equity means efforts to ensure that all people have full and equal access to opportunities and enable them to live healthy lives, and we'll talk about that. A funny story that I have from my days at the School of Public Health at Michigan was I always talked about the quality of life. And for those of you, any physicians, public health practitioners in the room? Okay, so when you start talking about quality of life, they say, well, what do you mean? Are you talking about morbidity and mortality? How are you measuring quality? And in planning, we might say, well, quality housing, efficient transportation, good quality schools, nice social, strong social cohesion in a community. But in public health, they're very specific about, when you say quality of life, what are you talking about? And that got me thinking about, how do you measure various things, and how do we think about people's health? Certainly, we know over the last 20 years or so, our healthcare costs have been exploding. There's been some stabilization with the Affordable Care Act now, but essentially, it's roughly 17% of our GDP. But more importantly, 75% of our nation's healthcare spending is on chronic conditions. If you know people like I do, the communities I work in, lots of people have diabetes. Very few people die of diabetes. You die of diabetes complications, right? So the types of treatment can be very expensive. People can't work, they have disabilities. So all those costs really start to add up. Much of it is preventable, as I was saying earlier. If you look at some of the diseases that impact certainly Americans, but if you travel the world now, you're starting to see these same issues elsewhere: coronary heart disease, type 2 diabetes, obesity, and so forth. Much of this is preventable. 60% of premature deaths, according to my colleagues, have to do with behavior, social circumstances, and environmental exposure. Right? We don't even know what the long-term impacts of a place like Flint, Michigan is going to be for those children that are exposed to lead poisoning and other communities like that. Or the issues around violence and homicide, places like Chicago or East Oakland, where I do some work, or Bayview Hunters Point in San Francisco. Just to reiterate the point, you see our projected costs have gone up over time. If we compare ourselves to our healthcare and social spending as a percentage of GDP compared to other countries, so you have France, Sweden, Switzerland, Germany, Netherlands, US, you see we spend 16% of our on healthcare compared to other similar countries that we compare ourselves to. Yet we still rank low in life expectancy. And I had a bunch of other slides like this. Many of you can find it day in and out. We spend quite a bit, and yet we're still not getting the results that we would expect to find, right? And so it gets down to the question of, well, why might that be? If you look at the expenditures on healthcare spending, quite a bit is on pharmaceuticals now, certainly on these chronic conditions and so forth. And so my colleague, Lynn Syme, who's at the School of Public Health at Berkeley, he often talks about, look, we have to challenge the medical model. Like, certainly we know that physicians are extremely important in our day-to-day lives, but we also have to think upstream. How do we prevent people needing to go to the hospital in the first place, or being able to, at least as they age, then go to the hospital? But instead of just relying on prescription drugs, I see young people now in middle school who are type 2 diabetics, and they're having a hard time focusing on learning and so forth. And so what Lynn Syme says is, when we think about risk factors, right, the medical model does a good job of identifying certain risk factors of a disease, and then tries to develop interventions. At least that's what they tried to do in the first place. And then what ends up happening is that we don't do such a great job that we think. And even in cases where we do, so even if risk factors are identified, it's difficult to get individuals to change their behavior. Many years ago, most of you are probably too young to remember, but some of my colleagues in the room, Phil Graham was on the Senate floor. He said, only in the US where you have people who are fat who are complaining about these health issues and food insecurity and so forth, right? There's many people who believe that much of what's going on has to do with behavior. And in fact, if you look at some of the communities and the examples I'm going to show you today, it's very difficult for people to change their overall behaviors if their environmental conditions, if their social conditions are what they are. More importantly, my colleagues also say, even if we are able to identify risk factors, you still have such a large population that's always entering into the pool of at-risk people, because we're not addressing the issues at the community level. We're not changing people's everyday environment. I have a colleague who went to Harvard Medical School. She went to go work in New Mexico, and she said she would have patient after patient coming in saying, I have this issue or that issue. She would prescribe pharmaceutical drugs, and she said they just kept coming back. And then she said she started to ask, what's your home life like? Oh, well, we're having a hard time paying the bills. We've lost our jobs, so we have family relatives, and extended family members living with us, and all these things. That was causing all kinds of stress for them. And so instead of her just prescribing prescription drugs, she said she started to then say, maybe you can go get help over here, or maybe you can go get some access to better education here for your children and so forth. And that got her moving into this realm, and now she's doing a lot of great community work at University of California, San Francisco Medical School. Much of my work looks at these broader issues, as I said earlier, of community level factors, but also regional factors. So how do people's access to quality food and proper nutrition impact them? clean and safe water, quality housing and urban design, access to affordable and efficient transportation. So one of the ironies of this movement back to the city is that we're saying, let's reduce our greenhouse gas emissions. Let's be more sustainable. And in fact, in my research, I'm finding in places like San Francisco, people moving further out, their commute times are actually increasing. Stress levels are actually going up. People are spending more time in their car, not with their children, and they're moving into environments that are not as healthy. So they're going to the drive-thrus with fast food and so forth, right? So there are all kinds of implications. We know, obviously, the impacts of air pollution, environmental toxins, but also spatial segregation, whether it be racial residential segregation, economic segregation, the growing poverty and inequality in this country and globally. All of these are having huge impacts on people's lives. And recently, my students and I were asked by the city of San Francisco and people at colleagues at UCSF Medical School to really look at the issue of violence and violence policies and preventions in the city of San Francisco. And you would think a city like San Francisco is always in the headlines for, you know, the tech companies and the housing costs and so forth. But in fact, as you start to see rising inequality, you see these certain conditions in some communities that are struggling to make it, right? So the stressors are definitely there. If we look at life expectancy, so this is Alameda County in the Bay Area. Red is for 74 years or younger, 74.3 years or younger. This is East Oakland. You have some of West Oakland, South Berkeley here. And then you overlay that with poverty levels, right? So the darker, certainly more persons living in poverty. So if we go back, life expectancy, poverty, it's almost the same map, right? And then if you were to overlay diabetes, infant mortality, crime and violence, you start to see very similar patterns. So clearly where we live matters, place matters, and we have to figure out what are those key factors that do matter in people's lives. And so I just want to talk about two projects I've started with colleagues at Berkeley and elsewhere that are trying to address some of these issues. The first project is called Rethinking School Lunch Oakland. It's a very simple idea that says we want to bring locally sourced food, meaning California food for California kids, in the Oakland Unified School District. There was a story on the NewsHour with Gwen Eiffel talking about this new initiative, and they were growing, Oakland Unified School District is buying asparagus that's grown in South America, flown to China to be packaged, and then flown to Oakland, California for the kids to consume it. That's 17,000 miles traveled, right, for asparagus that we grow right in California in the Central Valley. So in the school district in Oakland, you have about 40,000 students, almost 90 schools, over 7 million meals served annually. And of those 40,000 students, 70% qualify for free and reduced lunch. Right? So they're living in poverty, or certainly in the Bay Area, you're not making much money. Their parents or guardians are not making very much money. And so you have an opportunity here to do something about this scrumptious lunch that they're being served. Right? This is what people are getting, and this is actually one of the better meals that you'll see. Much of the meals are packaged. So what children are going to eat on Monday will be prepared on Friday, then freeze-dries over the weekend, and then heated up on Monday. And I know, obviously this is a skewed population, but highly educated people. There's probably not anyone in this room that would want their children eating this food. But somehow it's okay for roughly 40,000 students to eat this on a daily basis. And it's gotten so bad that children who are not eating at all, that are extremely food insecure, won't eat the school lunch, because if you eat the school lunch, that signifies to everyone that you're extremely poor. So I had a school principal break down crying because he said the food is so, he tries to model it. He tries to go and eat the lunch. He says it's so bad, he has to go back to his office and throw it away. And so the kids that actually do eat the lunch because they're really hungry, they're ridiculed or teased. And so what administrators did back in 2011 said, let's do a feasibility study. It was funded by Tom Steyer, billionaire environmentalist, and Kat Taylor, who runs one of the largest community development banks in the United States. So the Tom Cat Foundation put money behind this. The California Endowment, one of the largest health foundations in California and in the United States. and some other Stephen J. Bechtel Foundation, Bechtel Jr. Foundation and others, to do a feasibility study to say, what would it take to bring this locally sourced food to Oakland, to improve the kitchens and so forth. At the same time, the Oakland Unified School District was doing a facilities master plan. And just to give you some context, the reason why they were doing a facilities master plan is they try to keep everything up to date so many years, but they've had to decide whether they're going to close schools or not, because people had been moving away, right? So they were thinking about, what do we do with some of these older schools that are around? How do we repurpose them? How do we utilize them? And what ended up happening was in 2012, a measure was passed, Measure J. About 84% of the population in the city voted for it. It provided $475 million for food, or to improve the school facilities. Of that, a big portion went to food, but $40 million just went for a central kitchen, education center, and an instructional farm. Here's a picture of the central kitchen. This is where the main facility is, or will be. It's construction starting now. Here's the instructional farm. There's education center over here, and then there's a little plot for community residents. They want to have a after-school farmers market or on the weekends. Here's the story by Gwen Eiffel talking about this school lunch program. And so, what could go wrong? What could go wrong? Did anyone have any sense? I mean, everything's lined up. You have the money. You have the political will, at least at the administrative level. And suddenly I get a phone call from the General Counsel of Oakland Unified School District and said, help, please come to this meeting with the funders, with other people from the school district and some community groups. What could possibly have gone wrong? Any guesses? Zoning could be a potential issue, okay. Well, anything else? Community participation. There's a community-minded person there. What else? What else? Dietitians. Okay, so it gets complicated real fast. So they called me, they sent me the documents and events. Just could you come to this meeting? They didn't give me any background. I thought, this is a slam dunk. Like, what's there not to like? Turns out that this center at the time, now it's named Marcus Foster Center. It's named after the first black superintendent of Oakland. They were going to tear down the school named after him, designed by a black architect, right? Didn't reach out to the community at all, so none of the neighbors knew this was happening. And at the same time, there's a fear of gentrification and displacement. So some people are being displaced now. And Kat Taylor runs this community development bank that I talked about. There were rumors about, during the subprime and home foreclosure crisis, that some of the money they had lent to one of the local real estate developers bought up a bunch of homes in West Oakland where this new facility was coming along. So it got real messy real fast, and we had to get engaged at the local level and say, look, we need to get residents involved. So they reached out to Attitudinal Healing Connection, a community organization that residents said we want murals because the building was not something they liked, even though it's gotten all kinds of architectural awards. It's designed by Cody Anderson and Wozni, which they specialize in building educational facilities. So residents start getting involved. They actually paid muralists from the community to actually get to design this part of it. They then had me do a series of community meetings with people to say, what would you like to see? So one of the things people ask, well, with this facility, what's going to happen to the students who have special needs that were at this older school? Why can't you just preserve it? Why do you have to tear it down? What kind of jobs are we going to get? Right, so all these other things before we even start talking about just children's health. Like most of the meetings, we never talked about the children. It was all about all these other things. So we had to get through that. And as we started to have these conversations, some things came from this study. So this is not the best design, but here's the center. Over here you have local community partners. So the idea is that now there'll be local procurement. So you'll buy locally. You will contract locally. So that the school district now has a policy to buy locally. Here's some of the local farmers that are providing fresh produce at the center. Also, we know that there's an issue for STEM, so science, technology, engineering, math, for students to get more involved in thinking about their wellness. So now they're building an educational component to tie into the education center, which is to actually train students for culinary positions, to be entrepreneurs. There's a big food scene in Oakland now, so everyone's getting priced out of San Francisco. I don't know if you saw the New York Times today blaming the tech companies for Palo Alto and the South Bay not having any great restaurants anymore because they're Google and Facebook and all of them are getting the best chefs to come work for them. But the point is that they wanted to not just have a school and to bring healthy food to students, but to tie education to this, to build real community, to do all those things. Now, of course, being a researcher, I said, this is great, this is wonderful, everything passed, people decided not to sue under CEQA, California Environmental Quality Act. But then I said, you're missing a golden opportunity here. As a researcher, what might you want to do? Are you public health at all? From a public health perspective, what might you do? If you have this opportunity now, you have the current school system with what they're serving, and now they're switching over to healthy food.
You would monitor their health outcomes to see if they improved at the school.
Boom. You would monitor health outcomes. So that's exactly what we're doing, and I'm going to talk about the funding we've just gotten to do. So we want to know, these are a number of questions which we can't possibly answer, but I'm working with them. I'm the co-PI with the multidisciplinary team. We have a scholar from law, a scholar from education, a scholar from public health, and then there are two of us in urban planning that are looking at this. But how has the food just improved? Is there an increase in health benefits, which we can't possibly answer at this point? The level of students and families that have knowledge about the food system, you literally have students who think peaches come from a can. I'm not making this up. They think peaches come from a can. And that's why they went to education center. Career pathway component because of the educational conditions. Working conditions for employees, turns out nutritional staff members, which we're not surprised, but don't get paid very much money. They're being priced out and moving further away, and they're saying it's not worth my time to come in for $12 an hour for just 3 hours a day or 4 hours a day. But more importantly, people like Tom Steyer and other environmental people say there's an opportunity also to measure the environmental impact of serving locally sourced food, not getting it from other places, some frozen food from Chicago or from China and so forth. And then the overall impact to the local economy. Some of my colleagues had talked earlier about the zoning issue. Turns out in the state of California, the school districts don't have to go to the city at all. And that's where there was a lot of tension with the city and community residents. As community residents said, well, you haven't talked to the city about this. And they said, we don't have to. We go to the state. And we have to answer to the state. And so they control how land gets produced. So we've gotten this seed grant money, $200,000 from the Berkeley Food Institute, Tom Catt Foundation, Stupski Foundation, to take data. So there's the California Healthy Kids data that's across the state. Turns out that Oakland Unified School District has 2,000 fifth graders that have participated in that survey, as well as 12,000 parents, asking them everything from their food consumption and food security. And so we're analyzing that now, and we are taking a subset of those 87 schools I talked about earlier and distilling it down to 20 schools to do more in-depth analysis and then set us up to apply for a bigger grant that would say, now let's measure the health impacts over time. So we're pretty confident people are interested in funding it. We've had conversations right now with the Robert Wood Johnson Foundation. Stupski is interested in putting more money in. If you're not familiar with Stupski, they actually only operate in 2 places, Hawaii and pretty much the Bay Area, because that's where the private family foundation people lived and have some affinity. And so they're willing to have a bigger conversation to put close to $1 million into this project, because it's going to take some time. You're going to need a team of researchers to follow through. But the point is, if you look at the role of a public entity, like a school district, if you can get them to make different policy choices, you can have some real impact. And we're already seeing it, not necessarily in the health component, although the children who are starting to get some of the healthy food, because they're not waiting for this facility to get built, it should open next fall, but they're starting to bring in as much healthy food as possible, and it's tied to a bigger initiative called California Thursdays, which is every Thursday in California, as many school districts as possible, I think they're up to 82 now, that on Thursdays serve locally sourced California food for California kids. That's having a huge impact on the food system in a positive way, and we're starting to see some impacts there, so we are going to measure that. I now want to move from a very local example to one that in the international context in Chile. So since 2013, I've been traveling down to Chile in the area primarily of the Male region, to a city of Talca, about 150,000, 200,000 people. And they were largely have a rural economy. They have also Central Valley. But in 2010, they had an 8.8 earthquake. This is the high school downtown. This is one of the banks. But this earthquake really devastated a big part of the city. So you have some areas that are developing, while other areas are still left like this. This is a picture just from last summer. You can see some of the vacant property. So my colleagues there have been very concerned about the level of poverty, the health conditions for people, certainly in the wintertime with people burning trash and things. The air quality is not the best. So I got a grant last summer, took my students to Chile, and we continued the studio class through the summer through the fall. And one of the things we looked at is how would you rebuild the downtown, right? How would you use the local universities as anchor institutions? How might you create some entrepreneurial activities? How could you attract some types of investment? And that led to a broader conversation with the Chilean government, primarily the Ministry of Housing and Urbanism. And I'm happy to say that the people who were reaching out to me were architects, not planners. Everyone that I work with at the Ministry of Housing and Urbanism, there's about 6 of them, and 4 of the 6 are architects. And the other have engineering degrees and some other related degrees. And they were quite concerned about the inequality and the lack of social cohesion. And so they said, we want to float a policy that would be national, a pilot project called Urban Sustainability, Equity, and Social Integration Project that would really focus on doing a number of things, but taking the most distressed housing, some of my students here, the mayor of Talca, but taking some of the most distressed social housing and neighborhoods and renovate them. So one area that we think we were going to start with is Las Americas, which is about 5,000 residents, almost 1,200 units of housing. And the idea is that very similar to Hope 6, right? The problem with Hope 6, we displace people. In this case, we actually want to keep people in place and not only just make the physical environment better, but change the overall surrounding area as well, and to create economic opportunities and social opportunities for people. The real issue is how do you get access and talk to residents? Turns out this area is extremely organized. They have an underground radio station. That's not so underground anymore, but during the Pinochet era, that's when it came up. They have their own child care center. They have a workforce development center. All of this being a community that's fairly isolated, of only 5,000 people, and realizing that they were really on their own. Government wasn't helping them. And the only people who really stepped in were some of the NGOs in the area that started to work with it. And so we now need to collect baseline analysis of where are people at in terms of their health. Just self-reported health. Is your fair, good, poor, check, do they go to the dentist, do they go to the doctor? A survey of all of these things. Who their social network is. Who are they connected to? Do they know their neighbors? What's the level of social cohesion? What's their socioeconomic background? So are they working, not working? And then lastly, we want to basically think about ways to build their capacity. Right? So that's what we started out thinking. And now we've evolved a little bit more to say, not only do we need the baseline, but we need to have studio classes that I would run, partnering with our colleagues at the Catholic University, as well as my colleagues at Sudmale, which is an NGO, but to start to actually engage residents early on. So what we're starting now in the fall is talking to all the residents, trying to survey every single one of them. I did this in another project in San Francisco in a public housing development. We surveyed residents. We hired residents to do the surveying because they knew who lived there. Sometimes there are people living there that aren't on the list to live there. We are measuring people's social well-being. Again, that's just self-reported. And then trying to look at the level of community capacity. So that's just baseline. Then by next summer, we want to start to engage in, they hope to start construction then, tearing down some of the development, move people into temporary housing while they do that, but get residents involved in the process, citizen participation. What would they like to see in terms of design? What would they like to see in terms of programming, in terms of transportation networks and that sort of thing? The government can play a big role in helping some of this happen. Also, we are just trying to enhance their overall trust of government, because you find people who say, I don't trust government at all, I don't do any organizing, and in fact, you know, if Weiping, if you lived in the community, you would have everyone over at your house on a Sunday and found out that you actually are the organizer. They just don't call it officially that. And so getting people to now come forward and really be a part of that. So I met countless people when I was there who said, I'll talk to you off the record. I'll talk to you, you know, come to my house, they'll cook food, and they'll have a lot of people show up. And they're very organized. But what they don't do is trust government to the same extent. They'll trust some of the NGOs, but trying to really break that down and really get them involved in the process. And then lastly, to the government's credit, and I hope they stick to this, but they want to do a longitudinal study to say not only are we going to do before the development, get the baseline, but during development, see how well we're doing, and then after the development is done, have we done what we said we were going to do? So level of social integration, building new, not only just the 1188 units that need to get built, but adding new ones. Are people's socioeconomic status better off? Is their health better off? And the social programming and all that, is that more supportive than it was beforehand? And so that's the big challenge. There's a lot of political will to get this done. We are excited to get going on this. I'm going there over winter break, which is a nice time to be there. When my students, I took them in June last year, and they thought they were going to have this great time in Chile, and it was freezing because we were 3 hours south and in Talca. And so we really hope to get this going, and that we would not only monitor how well the community organizations do, but also how well the government does, and really bring about real change. And so we are setting up a whole research agenda around that, and to really bring about some kind of change. So I wanted to leave some time for questions, but I wanted to thank certainly the Berkeley Food Institute, the Center for Eco-Literacy, Oakland Unified School District, and then my other colleagues that are part of the Rethinking School Lunch Oakland program, as well as the Ministry of Housing and Urbanism in Chile, and of course the foundation. So thank you, and I look forward to having a robust conversation.
Maybe we join
Yes.
here and sit down, and in a way we can answer some questions.
Yes.
And maybe let me take this advantage to ask you some first questions. So Malo, your talk really kind of shows us this, saying by one of Harvard professor, Professor Caden, that to plan is inspirational and to implement is divine. And your presentation really shows us that from ideas to practice, and then to actually have an impact on children's and residents' life is a really kind of a continuum that in which different, of us, architects, planners, and organizers can all be involved in. And so, your talk also shows that there are multiple sources of health disparity. And you mentioned there are socioeconomic, elements. There are also elements from the built environment, elements from exposure to the environment, and we know that in terms of health equity and environmental injustice, that the poor, the more marginal residents and children tend to live in the parts of cities that are more exposed to such risks. And so, and your work also helps us understand, how you can change individual perhaps sources and the potential impacts it could have. And so my first question for you, if I may ask two questions, and then you can answer, and then we can open up. And my first question has to do is, and we know, particularly as health is related to the built environment, there are a number of factors, and one of the important one, as you show, is this access to healthy food. But we also know in children's lives that the habits of being more active in transportation, more active in their recreation, more active in their general lifestyle. So how do you see this single pronged approach will fare in terms of this experiment, not experiment, actually, sort of a new approach in the California Oakland school district? Should we consider, and how should we consider, a little bit more multi-pronged approach that, because we know that the children may be eating quite healthy at school, but when they go back home, it's a different situation, yes, right? They may be living in places where there's food desert, yes, there's deprivation on multiple fronts. They may be living in places where they can't walk, they can't ride their bikes. So how do we kind of juggle and sort of struggle, in a sense, in planning with this sort of multiple kind of deprivation, but we can only cut in, from this end, and how do you see us move forward in that?
That's an excellent question. I'm glad you asked it, because I think for the students in the room, how many times do you feel overwhelmed by all the issues, right? It's so complex, and I hear this at Berkeley all the time. The students want to solve the world. But at some point, certainly for me as a researcher, you have to think about where can you have some impact? How can you get something implemented now and not wait? We could fill up this room with a number of studies about health inequities. When I go talk to my colleagues in public health, I'm like, I'm not going to read another study that tells me, violence matters, walking matters. We know this. What are we going to do about it? And so I think that I hope I don't come off through my presentation that it's just a one-pronged approach. It's a multiple approaches we have to have, right? I just saw an opportunity through the school district to say, here's a large public entity that is directly responsible for, of the 40,000 students, 70% qualify for free and reduced lunch. And from that, you can not only provide them with healthier food, you also can support local farmers, many of them people of color. You can support some of the truckers. Turns out that they're not unionized at all, and that they were working in these bad conditions. So the nutritional service workers. So anyway, it leads to all these other things. But I think the point you're bringing is that this is one aspect. What about the broader issues, right? What about the broader? They still go back to these other. They go back home to areas where they may not be walking, or it's not safe for them to walk. And I think you have to partner across the board on all these things. One of the big resistance to this development was not that people didn't think it was a good thing, is they said, if this gets built, we waited all these years, when there was all this disinvestment, we stayed in the community, and now that we're getting displaced, now you want to bring in healthy food to the kids? So for some people, they saw, if you build this, we're going to be displaced even faster. And it's a nice facility that's coming up. The older building was beautiful for the time it was built, but then it didn't last. But if you see where this facility is being built, it's changing the neighborhood in terms of how people walk, how they interact. It's a multi-pronged approach. And I think as researchers, as policy analysts, as students, you have to figure out, where do you think you can start to engage? And you're going to engage in multiple levels over your lifetime, not just in say you work in a neighborhood CDC, or you do some international work for an NGO. That's right now. But later on, you might be doing something totally different. The point is, can you learn through your initial engagement of what might work and what doesn't work? How do you get something implemented? Who needs to be at the table? One of the most fundamental things that come from this kind of work is you have to talk to people. Right? Design is wonderful, architecture is wonderful, planning is wonderful, but if you don't talk to people, what good is it? Right?
Thanks. Yeah, so my second question also relates to your second project, which you actually brought out also how maybe the living environment, the built environment may be reshaped to, to help sort of achieve better health outcome. And I think that's something that a lot of us here are very interested. So I wanted to kind of ask you to maybe give us a little bit more insight into sort of how some elements of the built environment, let's say the housing itself, the public space in the neighborhood, or the streets and the alleyways in the neighborhood, maybe and can be redesigned or designed in a way that's actually more sort of in a way affordable. This is a pretty, you know, sort of low-income neighborhood, or affordable, but also fairly effective in terms of achieving some health, you know, positive outcomes. So perhaps I just want to hear a little more of that.
Yeah, that's another very good question. If you look at this area, and you know, given the time that I had, I can go into, I could just talk about one project all night, but I wanted to show some perspective of national and international. If you look at this area of Las Americas, it is your typical community that's been isolated, right? If people know the Bay Area, it's like North Richmond. If you blindfolded me and dropped me off in Las Americas, I would tell you I'm in North Richmond. You have modest homes with fences all around them. People have a dog to protect them. You have poor infrastructure, meaning exposed pipes. When it rains, you would never want your children playing out in the water because of the toxins that might be in the water. Same thing in North Richmond. So there are many areas to get started. One is just basic infrastructure. People need sidewalks. People need the development that's next door where they've built a wall to not throw their trash over into this area, which is happening. Middle class development next door is throwing their trash over into Las Americas. So there are these basic things such as sidewalks, the piping, they're exposed, people walk across pipes to get across the river. Helping people be a part of the development process. So as I said before, they're highly organized already, which I found to be very amazing because they have a quarter of the resources that many of our communities here have. And yet the social capital, the amount of organizing that happens there and them being able to get things done is astounding. And we understand the reasons why that might be. But there are some basic things that we can do right away. The housing is super important to tackle because it's so old. People have added on to the housing. They've added their own electrical upgrades. And so that's become a big issue for the Chilean government, is to say, how do we then come in and compensate people adequately and then build new housing that they actually would want to live in? And it takes a group of people. It can't just be planners. It can't just be architects, but it has to be all the wonderful people I've been, and, you know, from engineers to community organizers and so forth. They're all part of the process.
Thank you, Malo.
Yes.
So maybe we can open up to questions. You know, I have more questions, but I think we could perhaps get some questions from the audience, from the floor, and go from there.
Yes.
Hi, that's a really fascinating presentation, and as a former West I have a question about the school and the issue of gentrification and how much that came up in the public meetings around the community's anxiety and how is it expressed in these questions of improvement, because that certainly was an issue when I lived there, you know, quite a while ago, and I was curious sort of what's the current conversation about that. And then in what ways were some of the aesthetic questions about the school a kind of remarking of that, you know, as the ability of the community to sort of still see itself reflected in its own public sphere? Yes,
the gentrification question was everywhere. If it wasn't said, it was the elephant in the room. And many people, so when Oakland Unified School District first approached me, I never told people what I did. So I just said I work for the school district to do some engagement. I didn't lie, but if people asked me, I'd say, yes, I'm a professor, but I wanted to first just engage and hear people's stories without them being biased. And for about 8 months, I was the man. I was just here to help bring in white people that were going to gentrify the neighborhood. And it was April 1st, 2014, I'll never forget. I had enough. And I said, I got up and I said, enough. I'm not going to hear it. I said, you can Google me. I care about these issues. That's the only reason why I took this project on. No one's telling me what to do. I said the school district can't be these backroom dealing, doing this big conspiracy to take all this land from you, and then also on the other end be completely incompetent. I said it can't be both. So which one is it? And I said, from my honest opinion, here's what I think you have, is you have people who want to do right by the students who live there. Unfortunately, at a time when there is real pressures from people moving out of San Francisco into West Oakland. And unfortunately, it comes down to a lot of trauma that people have had when, sorry, a little bit of inside talk here for people who are not from the Bay Area, but when BART came through West Oakland, tore up the community, when the U.S. Postal Service came in and tore up the community, you had 7th Street corridor. Yeah. That was,
I live right next to
that was vibrant, Esther's Orbit Room, all those things. It destroyed the community. Then the earthquake, ironically, in '89, where the Cypress Freeway fell down, now they made Mandela Parkway a little bit better, but you start to have more and more people moving into the neighborhood, and they happen to be people from all over the world in different backgrounds, and not necessarily just black. When I was canvassing, I was surprised at the people I was meeting. But one thing that's on, certainly for the black community and a lot of people of color, longtime residents of West Oakland, was gentrification. And they say, oh boy, as soon as they start talking about organic food, you know it's over. Right? Like, you know it's over. And so what I said is, well, why would you oppose something when there's nothing but good coming from it? So why don't you ask for something? So what is it that you want? We're always conditioned to say what we don't want. Let's condition us to say what we do want. And then when we start having these productive conversations around community benefits, well, what do you want? Well, I know Sister So-and-so, she actually cooks some mean greens and is trying to market her stuff at the farmer's market. Well, guess what? Community can have access to this industrial kitchen to do their own startups. My brother needs a job on the site, so we reach out to the unions to see that they can hire, right? So it's all these things you have to do, but it's a drop in the bucket, going back to your first point of how do you, when you're thinking about global investment, if we want to look at what's the causes of gentrification, it's, first of all, not enough housing, period. That's everywhere. In all the strong market cities, that's around the world, not enough housing. And then global investment of housing, China, Russia, South Korea, Canada, you can go on and on. Lack of jobs, bifurcation of the labor market. So you have now high-end jobs being created on one end, largely the middle class suffering, although some of my economist friends said I should be happy because the data seems to be a little bit better. That just came out. Middle class has stabilized, actually gone up a little bit in terms of pay. But largely people in the sharing economy, which, Uber, Lyft, that's what you see a lot in this area. And it's so many of these other factors that are, and issues that are impacting people's lives that they're afraid of anything positive, because if you make it too nice, everyone's going to come, right? But then they get upset if it's not nice enough, and they're like, well, why didn't they do this before? Oh, because it was mostly black. Now it's not mostly black. That's why they want to do it. It's complicated. And your second question, I'm sorry.
I used to live near the post office. I know exactly where you're from.
It's hard, and I think that the last thing I'll say on this is that I've worked in a lot of economically disadvantaged communities, and I've never been in a community that said we don't want investment. What they want is to be at the table to say what kind of investment they would like to see in their community. It's not that they don't want investment. They just don't want the typical corporate chain that comes in and has no alliance or accountability to residents. They want to have some impact. If you look at the case of San Diego, Saul Price from the Price Club invested in City Heights, right? And so you had a number of mom and pop immigrant stores and whatnot that were there. Once the developments are coming in, they bought in Panda Express. They brought in Albertsons supermarket, even though there was Nicholas Tran ran the Vietnamese grocery store that was doing quite well. There were Somali residents who had their own. So it's not that they don't want investment. It's they want to have a. So once the conversation changed to say how can you be partners in this process and what the overall impacts can be, from health to jobs to procurement to educational achievement. That's why I have someone on the team from education at Berkeley, because the data says if students have better access to food, they might have better test scores. So let's find out if that's true. Let's find out if that's true.
Actually, just to build on that point, I think in your book you talk about some of the community organizations actually, mobilize residents to be at the table. Perhaps you can tell us some, sort of really effective experience of that, and in a way that, to help us think of sort of moving towards, that practice.
Right. Whenever, so in much of my work, certainly, obviously, being a professor of community development and working at this intersection of health equity, the foundation of community development is community organizing, right? You have to organize. And so communities that are not as organized and end up having some of these broader issues that they're unable to address, they're unable to address these issues because they've been impacted by a lot of disinvestment or these other things that we're talking, these external factors. So in my book, I look at San Francisco, the Mission District, and New York with Brooklyn, looking at Prospect Heights, Crown Heights, in Washington, D.C., the U Street corridor, Logan Circle, all the way up 14th Street, and then in Boston, primarily looking at Jamaica Plain neighborhood as well as Roxbury. And what you find in the four cases is this. In San Francisco, I looked at the Mission District, predominantly Latino community. And they said, in the first dot-com boom, we faced serious displacement and lots of development. So we're no longer going to just make the economic argument. What we want to make the argument about is our contribution to the city, our culture, politically, economically, socially, artistically. And they went to the city of San Francisco, to the San Francisco Historical Society, and said, we want to start documenting every mural and everything that's happened in our community in terms of and what we've contributed. I mean, it's very San Francisco, going way back to the founding of California and beyond, right? So, but what happened is the Board of Supervisors, which is their city council, they voted unanimously to support a resolution that named this area within the Mission District the Latino Cultural District. It's a Latino Cultural District. And tied to that, they then went to start looking at planning and say, how can we create a special use district, right? So that if you want to build anything, you have to go through an extra layer, an extra process to get things built. And so that organizing was extremely important because you have people talking about their culture, their identity. It's very hard to argue against people's history, identity, culture. And one of the best meetings I went to was it was at Brava Theater, and they were talking about the Latino Cultural District and how it had passed and what they want to do. And one of the young tech workers said, look, I'm all for this being a Latino Cultural District, but before he could even finish, this man stood up and said, you don't go to Chinatown and tell Chinese how to be less Chinese. You don't go to Japantown, tell Japanese how to be just less Japanese, and you're not going to come here and tell us how not to be Latino. And they actually brought colleagues from Los Angeles, from Little Tokyo, to come up to tell them what they were doing in Los Angeles around the MTA development. And this idea, and who speaks Japanese? Anyone in the room speaks? Is it matanai? Matanai? Like you use what you, take only what you use. I'm saying it wrong. I always mess this up. Yes. But so there are these concepts, right? The concepts of saying of conservation, of only take what you use. It's very difficult to go and develop in these areas if you don't embrace these principles. So that's an organized area. Now let me tell you about the case that broke my heart. Washington, D.C. What happened in Washington, D.C. that might be different than sort of the issue in San Francisco? We know that California obviously is linked long history to South America, Central America, and so forth. So there are these cultural connections, and when there are struggles around the world, the city of San Francisco, certainly the Latino community, has stood up and said, this is wrong, you can't. Yeah. So there's that organizing there. Washington, D.C., I talked to people who said, I lived through the Civil Rights era, I was able to buy a house, then I lived through the assassination of Martin Luther King, the uprising that happened, the disinvestment that happened, the crack cocaine epidemic, the homicide epidemic. And I would call and say, can you fix the streetlights? Can you get police to come out because there's violence in my neighborhood? Can you do those things? And they said, people wouldn't come. Their children, who were able to leave, moved other places. And you have the elderly who stayed, a lot of them elderly. Or the young men of color who stayed, who then got caught up in the criminal justice system who can't get a job. And so the people who are able to leave left, and then you start talking to some of the elderly and they'll say, listen, as soon as someone dies in my church, you have a land speculator or investor coming to see where their house was and can they buy it in cash. And the children sell. And now you start to see in Washington, D.C., obviously, you have the African American Heritage Trail. Here's where the first black Rhodes Scholar lived who taught at Howard University. Here is the first Kappa, whatever, you go through, people know D.C., you go through. And yet you're hard-pressed to find large concentration of black people in certain areas now. Yet if you go up to U Street Corridor, you have you have Ellington Apartments, named after Duke Ellington, Langston Lofts, named after Langston Hughes, Marvin after Marvin Gaye, Blackbird after, go on and on, Eatonville. I mean, all these nod to black culture history, and yet you have people who feel like they're being displaced. So San Francisco's, the Latino community said, we don't want to be a museum. We don't want people coming through and taking pictures of our murals and driving through. And unfortunately, in Washington, D.C., I had people say, we feel like we're becoming a museum. So organizing matters. Sorry to get in, but you start asking about certain things. It's like, that's where my passion is, so, yes.
Okay. Yeah.
I have a question about how you teach, so a little moving more into teaching, because I was really struck by your
comment just almost off the side of like, you just have to talk to people. And I would say that is one thing that we really actually don't teach very well in planning or urban design or architecture. We're taking our theory courses, we have drawing and representation. But the actual, when you just think about projecting forward, planning in a democracy, right? It is, most of it is really about interacting. And you seem to really have sort of a methodology that you bring to it with your students. So, and even urban design, one of the things what we did this year was to try to teach students how to interview people, just, I mean, as a core skill, right? But how do you, and we're also trying to look at the business school and to understand how people work in groups and what are these sort of ways of teaching interaction and facilitation. Can you just comment on that?
Yes,
or are there people that you're
giving me
with?
too much credit for having this methodology around this. What I say is this. So I remember the first time I came to New York, I loved the way the subway smelled. I love the way it smells. It just, that's city, that's urban, that's New York for me. So I joke with my students and I say, theory and practice, theory is so important, you need to connect it to practice. Theorizing and all the things we do in the university, it's the only opportunity in your life you're probably going to have all these people who think differently than you, that you can engage and really think big, right? So I love that part about the university. That's why I'm a professor. But if you don't couple that with, as I joke, you have to smell it, you have to touch it, you have to see it, you have to taste it. So I say, get on a bus, get out of the car, walk, just go explore, tell me what you see. And I think that you have to be proximate. You have to go see for yourself, because when you start to talk to people, I'm wrong all the time. I'm wrong all the time. I thought, this is slam dunk. Who doesn't want locally organic food? I'm thinking, Oakland Unified School District just gave me an opportunity to just shine because everyone's going to want to do this. And I was so wrong, because there was so much trauma around urban renewal. There was so much trauma around racial residential segregation. There was and all these other issues, right? But it took me to get out of the classroom and to engage, to start to really understand, what do people want? Yes, they want healthy food, but they have a whole lot of other stuff they're dealing with first. And unless you can engage on all these other things, food is a luxury for some people. I mean, it's a necessity, but it's like food. And that started to really resonate with me, is thinking about the other communities I'm working in. Violence. I work with young people in East Oakland that they can't go to a movie because they have to see where it's playing, what community they have to cross to go to that movie. They can't be spontaneous. And I didn't even know, here I am thinking I do community development, I know all about, violence impacts young people now in such profound ways. They schedule their lives around where they're going to be, around what time. And so, you know, like, why don't, you know, you read these stories, they've never been to the beach. They've never, because they have to cross 3 different communities and they might not make it. Right? I was so naive a few years back. I was doing some work in Richmond. We had a focus group for young people. It was a community development studio class. And all of a sudden, people start calling and say, you can't have that focus group. It's like, why not? As students from all across, we have these gift cards. It was very Berkeley, gift cards, and, you know, we're going to, like, icebreakers and tell us, you know, like, we know your life is so tough. And they said there's going to be violence there. The police called and said, you cannot have this focus group because there are rival gangs coming. Mm-hmm. And so that's why you have to get out and see. And if you're talking about urban design or building, you know, there's a place for theory. I love it. I think that that's what makes a university great. But you have to couple it with being proximate to whatever it is you want to understand. That's a big commitment.
Yeah, we have 3 hands.
Yes.
Here, 1, second, and then back.
All right.
Yeah, right here.
So I'm a dual degree with planning and public health. And the reason I was interested in it was because I'm interested in using the resources of anchor institutions to address pressing civic, social, and economic problems. How do we get anchor institutions to morph these notions of social responsibility to notions of shared value? In my undergrad experience, you know, I went to Penn, and they do a lot with West Philly, and anchor institution research is a huge thing there. And I was really hoping when I came here that that was going to be something that really shined as well, because Columbia is such a big stakeholder in New York City. So I'm just wondering what your thoughts are on that transition.
They could do a lot, right? So anchor institutions are incredibly important. My dissertation work is on this. One of my chapters in the book is on Boston, the Longwood medical area. Harvard's teaching hospitals. You have $7 billion coming in a year in research. Harvard's so competitive that even people who are administrative assistants have to have an MPH on their grants because they're that competitive, right? So there's all this money coming in. People want to build. You have pharmaceutical companies, everything wanted to be there. It's the Longwood medical area is about, you know, 40,000 people on any given day and 27 plus institutions. So it's very compact, small area. And yet around it, at the time I was doing my dissertation along Huntington Avenue, had public housing, Mission Main housing developments. And it was really looking at that connection between these anchor institutions and what they could do. So it went from, again, being proximate. So people thought, oh, what they want is housing, because the housing costs are starting to creep up. And what they might need is childcare and some of these other things. And people said, no, we need jobs. We need jobs, jobs, jobs. So they started a jobs program, which then led to a bunch of other things where people who didn't have a job suddenly started having health care. And this is before Mitt Romney passed Mass Health, so there was this discussion. But there was a lot of historical things that happened and why anchor institutions are so important. Harvard then said, you know what? And I'm not saying that they did this on their own. There was organizing that happened, and there's a bigger story. But they decided, we want to engage more. We want to start seeing how much we give to local schools, medical programs for the high schools, you know, all kinds of things. The mayor of Boston at the time, Tom Menino, said, we will tie development, so how fast we'll do the permitting process, to outcomes in the community. So Beth Israel Deaconess Medical Center, you want to build up above the normal height limits, we'll let you do that if you can prove what you've done for the community in terms of community benefits. Then at the state level, you had the state attorney general who said, Harvard's $1 billion institution. They start looking at the numbers and said, from now on, we want to start seeing an annual community benefit report from all of these nonprofit universities and hospitals and things to see, what are you doing for the community? So it's kind of funny that if you look at the Affordable Care Act, you can go back to Mitt Romney in Massachusetts and see how a lot of this began in terms of reporting, maintaining your community benefit, producing these community benefits reports, really investing in more community benefits in the community beyond just like a mobile clinic and that sort of thing. Now, if we fast forward to a place like Columbia, we know there's the Manhattanville campus, right? Moving into Harlem, another area that people are, obviously everyone's worried about housing costs and so forth. But it's an educational institution. It's a premier educational institution, and it has jobs, it has ideas and innovation, and there are ways that you have to embrace the community. I understand the need to develop. Like, I have not met a university that says, no, we're good. Everyone needs new office space, new research labs and all that. I get that. But it's how you engage. It's how do we win together? And, you know, I don't want to say that it's all kumbaya, because it's not. It's messy, but there are ways to do it, to where you could say, well, what kind of benefits make sense? Not where people are being stick-up artists, right? We know there are people who hustle and that could just be hustlers and say, we're going to organize for these community people, and here's what we want, all these things. But people who really will get the benefits, what is it that they need? So you think about this great institution in terms of public health, the medical field, architecture, planning. I mean, we're in GSAPP now. There's so much that we could provide communities. And the last thing I'll say, make sure I'm on time, is in Berkeley, they wanted to build the Berkeley Global Campus in the city of Richmond. So Richmond is about 100,000 plus people. It's also fearing gentrification, but working class. That's where Kaiser shipyards were. Rosie the Riveter came, the concept came from there. That Rosie the Riveter Park, because all our big ships were built in Richmond, and then the downturn came, so you had a lot of black residents who moved from the South and people of color elsewhere. So Berkeley said, we want to build a global campus. So Cambridge, Tongji University, all these different universities can invest and be right here. And they had this community meeting, and of course they invited, you know, can you come? And it was January, I think, June 25th, 2012, packed. 6 p.m., people took off work to show up. You're talking just coming out of the downturn in terms of the economy. Berkeley's coming to Richmond, and it's going to be a global campus. What's the first question that anyone would ask? It's packed. What is the first? So Berkeley has the architect talk for about way too long, like almost 45 minutes. No, literally, I mean, it was great. But when you're going on for 45 minutes about the hues and the light, people were, so what's the first question you think people asked? So after the dog and pony show, what was the first question? Excuse me, what are the jobs that'll be here for us? They look around, I don't know. Second question. Excuse me, what kind of investment are you going to do for our schools? Because you're Berkeley, you're an educational institution. I don't know, we don't know. It was the most embarrassing thing ever, because here you have a public institution paid for by the taxpayers of California, and they can't answer the most fundamental basic questions like the type of jobs that might be there. You're talking about the Lawrence Berkeley National Laboratory also building space there. At least roll out a STEM program for the high schools or the schools, something, right? So I elected not to participate because I think we could do a much better job. And it's not to say that universities provide everything, because universities are they have to educate. That's the primary mission of universities, to educate, to create, you know, obviously focus on innovation, all those other things. They're not a social service agency, but they could do certain things that other entities find it hard to do. And the last thing I'll say, I keep saying the last thing, but I believe in public entities. I believe that things like school districts, cities, hospitals, anything that is large, you know, universities, whether it be private or public, you can move millions overnight, more than a foundation can. I mean, Oakland Unified School District, not only do they pass this, but there's an equity policy I just worked on for them past March 25th. The equity policy is moving millions. Who they hire, how they retain teachers, the procurement. I mean, there's so much money in school. This is a $475 million bond that got passed. And that's just the bond, not to mention the state money, federal. So anyway, I go on and on,
Yeah.
sorry.
Malo, hi, thanks for your presentation. I'm really interested in the ways in which universities could partner with institutions and we live in this data-rich world,
Yes.
and the people in the universities know how to get to that information. To find a way to distribute services, and health services are one really fascinating thing, because so much is happening in terms of bringing services to people where they need them. Well, where do they need them, and how do you distribute those? I wondered, I think that's an interesting area. It's not so much about the big institutions and healing around the edges, which we've all worked on, but how can you actually pinpoint the needs in communities and get those services there when they're needed and before people are pushed out? And I wondered, in the school example from Oakland, whether you thought about feeding the community from the school, not just the children. Years ago, Chicago, under a different mayoral arrangement, had a big program for rebuilding schools and rehabilitating schools. And one of the things they did was to open the gates to those schools on weekends and in the evenings, and made those schools a part of life in those communities. So here's a school entity which is growing and providing food. Did you look at the possibility of the schools providing for more than the children, expanding on that? I mean, and Oakland has this amazing makers, growth in ideas of businesses. I understand you did a little bit for the schools, small businesses, but is there any way you can use the schools as a source for other services?
You can. So we talk about these in many ways as full-service community schools. So there's a movement to do that. The food area, it gets complicated because of zoning issues. So there are people who want goats and chickens, very Bay Area, and there are reasons why they can't have live farm animals. And there's a rumor that all these live farm animals were going to be there, and the neighbors went crazy about it. But they did leave a plot of land, about 3/4 of an acre, for residents to grow food that they want there. Yes, and then to partner with some of the local. There are a number of. You have Novella Carpenter, who wrote Farm City or Farm something like. Wonderful people in the community that are already doing this, right? So it's about supporting them. You have Dave Roche from doing all kinds of Mo Better Foods. So you have all these people doing. A lot of partners. Yeah. So in that respect, it's hard. But I think the full service community school is a big one, and there's more opportunities there to do so much more. And I have colleagues doing that kind of work. Is a little bit beyond my scope, but we can think bigger. Now, in terms of the university, I wrote an article a while back called, in the Journal of Environmental Justice, says, where's the public in public universities, right? And my whole thing is I think we need to rethink the 21st century university. The incentive process for faculty, as you all know, my colleagues will say, it's to get tenure, it's to publish, it's to do those things, to teach, to get these research grants, all that, which is wonderful. But at the end of the day, what's the role of the university? Is it to, solve some of these most complex issues? I mean, we argue that we're doing that now. I have colleagues in all the different disciplines doing wonderful things. But how do you translate that into real practice? So when you start talking about pinpointing services, we know about it. I mean, if we go do another drive-by research study, which we do all the time as academics, like go there, our students go into a community, they never see the data. They never get the changes, or we very rarely report back to them, and that's something we have to do. So it becomes very difficult. But I think if we could partner with the right people, right? We're good at identifying the problems. Faculty, we know we could go on and on about problems. My students joke, I'm always a downer in my classes, but what do we do about it? As I joked before, we could fill this room with studies, but what do we do about it? How do we take it to the next level? And I would argue that's where you connect with your alumni. That's where you open the university up to bring in practitioners or scholars in other disciplines that might be able to add something for a year. So we have this, we just launched our Urban Community Scholars Program at the institute I'm at, and we have people from government, the nonprofit sector, and kind of doing different things. But we have the former mayor of Medellin, Colombia, who's with us for this year as a scholar, and he's talking about violence this whole year. He wants to write a book about his brother was murdered, but it breaks down those barriers.
I think there's a question in the back.
You said you believe in public entities.
Yes.
And I do too, but I find that from within public entities, it's often challenging to advocate for a quality of design and design policy that is, beyond the bare minimum.
Right.
And as a designer, really, that's where public health came to my rescue, because when you can show health evidence, when you can prove that health outcomes would benefit, then that's a wonderful tool to advocate for inspiring design, because it also, happens to encourage physical activity or
Absolutely.
Have other benefits. But where I think we're still hitting a wall on a lot of projects is when we try to advocate on something for social capital, for social cohesion, for strengthening community ties. And that's been, at least so far, a lot more difficult to quantify and measure. I don't know if you've had any experience with that.
I mean, your observation is a great one. I mean, I think that public entities are struggling with resources. In the case of the ones I've been working with recently, and this is within the U.S. context, not only are they working with less, but they're working more. So during the recession, they laid off, many of the government agencies and public laid off a lot of people, and they haven't necessarily hired them back either. I think what I find is that you have, before I was one of those people, before I started working with like a school district or even getting more involved doing work for like the government in San Francisco or so forth on studies, you think, okay, yeah, some of these people are paper pushers and their job is to say no all the time and not say yes. And as you start to go inside, you realize how difficult it is, right? And I'm not saying that we know that there are people who are a problem, but it's difficult. They're under-resourced, the morale's low at times. But what I find is when you have that situation, you can't be innovative. It's hard to be, or the people who are innovative just get beaten down. It's like, just do what you're asked to do. In these meetings, don't think outside the box. Perfect example, Oakland Unified School District is losing teachers because of the cost of living. They have all of this land. So they said, what about if we build teacher housing? And other school districts are doing this, but being innovative and build teacher housing, what a concept. But then everyone beats them, the teachers' unions and all these other people start. So I think that there's no easy answer other than when I train students, getting back to Kate's point, is go and try to change these institutions. So I teach a lot of students at the intersection of community development and public health, or planning and public health. They then go to a health department, they get hired there, and they start doing planning. Whatever planning is, right? We could argue what planning is. Call me when you figure out what it is. No, planning happens everywhere. That's why I tell students, it happens everywhere. It happens in the hospital. It happens in the school district. It happens. The point is, can you be the change agent? Can you understand how to implement? Going back to Professor Wu's first point of how do you implement? It's all about implementation. Great ideas are wonderful, but if you can't implement them, they're useless in a lot of ways. I mean, they're great to aspire to. Big ideas, we know there's some big ideas. That's going to take some time to get there, whether that be adaptation to climate change and all these other, but we can get there, but it's how do you implement the basic things? And that's hard for government agencies to do, especially when they have to incorporate all these different ideas, limited budget. Sorry to give you, your question was very hard.
Sorry.
I think that's great. I mean, any more questions, or do you want to close, or?
I would just say that I think that sometimes we can feel overwhelmed by issues. I know I do. And you have to kind of figure out, and I'm speaking more to the students because I think I have to take the opportunity since I'm here, is where do you see yourself operating? Is it the maybe local level, regional level, state level, national, international, public, private? Start to try to think about those things and where you might first engage, because I know there's some great work happening in the private sector, some great work at the government, nonprofit. So you have to figure out where you can bring about change in the beginning. It's not the only job you're going to have, but sometimes my students fret over this first job or my second. Just get started. The best way to start is to start and to be proximate.
Thank you.
Thank you.